Good morning. We are here at the Anderson Center for Hair with Dan. Good morning, Dan. How you doing?
Morning, Dr. Anderson.
Great job yesterday. Today is post-op day one. The way it runs in medical parlance is the day of your surgery is day zero. Today's day one. We're seeing Dan back in the morning. We're going to have a look at his follicles. We're going to have a look at his sutures and just kind of show you what it's like the very next day. How are you doing today?
Feeling pretty good.
All right. How was your night last night?
Great sleep.
Okay.
No issues.
Any discomfort?
No discomfort at all.
Okay. How many hours sleep did you get?
I think I was in bed at 9:30 and up at 8, so full night.
A full night's sleep. Okay. Feeling good.
Feeling great.
Yeah. A lot of people tell me, after the procedure, they're like, that's it. That's it. I'm like, yeah, well, that's not a really painful or intense ordeal. Patients sleep really well the night after the procedure. Let's have a look at some of his follicles in what we call the recipient area. You can see throughout the front, we've got just a sea of follicles transplanted in between his previously transplanted hair, and they look perfect. So now we're going to have a look at Dan's donor area where the hair was taken from, and we're going to have a look at his stitches. Come on in, have a look. I'm here with Dr. Wetzel. We're both going to inspect this area. Now, the first thing you'll notice is that it doesn't look like anything has occurred back here. That's one of the nice things about the FUT, or the linear strip procedure, is that with hair of any significant length, you really don't see that anything has occurred. But if we kind of dig in, and they're right about that, there we are. As you look right here, these are the stitches that were placed yesterday during his hair transplant. The hair was taken from this area. Now, if you've been to the ER maybe and had some stitches in your scalp, those stitches tend to be large, like the laces on a football. But here at Anderson Center for Hair, we all do a facelift closure. This is the same suture material, and the same technique is used when closing up incisions from a facial plastic surgical procedure called a facelift. And so it's nice and tiny and elegant, and that's going to heal up really well. We always use a trichophytic closure, which really causes the hair on the scalp to grow through the scar, truly minimizing any appearance or evidence that a scar is there or that a procedure has taken place. For the first several days after the procedure, we'd like the patients to spray down the recipient area, spray down the follicles that were transplanted, and we provide a bottle of saline to do just that. And we're going to demonstrate that right now. Just tilt your head a little bit to the right. I'm just going to put some in here for demonstration. Patients like to know, and it just comes out like that. And you just want to do it until it's kind of wet and maybe dripping a little bit. And there's gauze provided to the patients as well. Just like that, keeps it wet, and you'd want to do that throughout the treated field about once every 2 hours or so in the first 3 days after the procedure. And what that does is help to prevent, it helps to wash away the serum and help to prevent a large scab from forming. And it just kind of helps the healing process quite a bit. Many patients ask, what is the follow-up like? When do I need to come in? Well, for patients from out of town or for patients who simply desire to come on in, unless your procedure is on a Friday, we invite you to come in the very next day like Dan has done. Dan has procedure yesterday and came in today just to have us have a look at everything. And if you're traveling on a plane or taking a road trip back to your house, sometimes that's handy just to have us, maybe rewrap your bandage before you go home. But typically, because of the fact that it takes a year for the hair follicles to kind of go through their process of healing in and then growing in their new location, really we don't need to see patients back for a full year. Of course, the exception is suture removal. The stitches are going to come out. We're going to see Dan again in about 2 weeks. The stitches come out on day 14. That gives us another chance to look at everything, make sure it's all good. For patients who've had an FUE procedure, there are no stitches, so we don't need to see the patients back at day 14. You're welcome to come in at any time in that first year for us to have a look at what's going on. Of course, the patient's job at home is to continue their effective hair loss prevention strategies. But really, at the 1 year point is when about 98% of patients have their full and final results, and I really want to see patients back to make sure they're happy with it. So we'll see you, in 2 weeks for your suture removal, but We'll see you in a year just to make sure you're happy with it. And throughout that year, you're going to be using your topical medication, using your laser cap. And I would recommend you get at least 3 or 4 PRPs, one every 3 months or so, to effectively prevent hair loss. All right, brother. It's great to see you.
Good to be here.